All right, well, let's go ahead and get started. Thank you everyone for coming. Excited to talk to you about CHICA, which stands for climate change. Everybody can see my screen, right? Okay. It stands for climate change, health impacts, and community action. So the goal, well, first we'll do introductions. So I am Rebecca. I know most of you have known me as the interim executive assistant for a little while. I was also an intern with the Alliance over the summer, but I will be transitioning out of those roles because we have Carrie and Erin to be taking over both of those positions. So I will be coming on full force into CHICA. So I'm really excited to get to work with all of you on this project. And I will go ahead and pass it over to Monica.
Hi, my name is Monica Hernandez. I am the new program director for CHICA with CHI. I look forward to working with everybody.
Amy.
Hi, my name is Amy. So I am the program specialist on the CHICA project, and I will be doing a lot of the administrative work. And I'm looking forward to working with a lot of you as well.
Meg.
Hi, everybody. So my name is Meg Long. I'm the Director of Training and Technical Assistance at the Center of Health Innovation. So myself and Amy and Monica are here to support you all along the way. So we're really excited to meet you all and to be working with Rebecca and see how this project gets underway.
Okay. Thank you, everyone.
And Rebecca, I just want to make it clear to folks that Center for Health Innovation is actually the recipient of the grant from the federal grant from the Office of Minority Health. And the Alliance is subcontracted to really work closely with all the health councils throughout the whole project.
Yes, thank you. So the overall goal of the project is to identify content of drought-related policies or variations in practices across the jurisdiction, so multiple health councils jurisdictions that contribute to perpetual racial inequities, or it can also be not creating a new jurisdiction, but revising or developing a new policy to decrease the health inequities that are caused by drought-related policies, and therefore reduce the impact on structural racism. So a quick overview, there'll be 6 health councils selected. So from January 2023 through September 2025, the CHICA team that you just met, and the 6 county and tribal health councils will work together to analyze how these drought-related policies may perpetuate the structural racism in New Mexico. So there's 3 phases. There's the planning phase, the implementing phase, and the analyzing phase. And as Susan said, this is a grant from the Office of Minority Health awarded to CHI, and we are just subcontracted as the Alliance, and health councils will also be subcontractors on the grant. So phase 1, that will be the planning phase, as we said, that's year 1. So the 6 health councils and the CHICA team will work to discover and analyze how the drought-related policies, statutes, ordinance, and laws in each of their jurisdictions will relate to how they impact the lives of the people in their community. And then the health councils and the CHICA team will develop research questions, conduct an assessment of how local policy making and decision making works in each jurisdiction, and also complete a feasibility assessment. And then lastly, health councils will develop what we're calling a disparity impact statement, DIS. That will include either a new policy or revising an existing policy, and creating an action plan for how each health council will address the identified factors that are impacting their community. So you may be asking, I think there's a very broad field of what impacts droughts, right, as we all know. So just to give you a little overview and examples of what kind of topics we could look at, it could be public water systems, such as rates and pricing structures or safe drinking water statutes already in existence in your jurisdiction, or maybe there isn't and you want to add one. Water conservation, such as metering and monitoring, water quantity, air quality, air pollution, and water and fire prevention, such as prescribed burn, stuff like that. Meg, did you want to add anything on this one?
Sure, yeah, and I see Diana also has her hand up. Did you have a burning question, Diana, before
My
I
only
jump
question
in?
is what the feasibility study would be measuring, the feasibility of changing a policy or, okay, all right.
So could you go back to the last slide real quick, Rebecca, if you don't mind? Great. So year one, as you can see, there's quite a bit to it in terms of like assessment and feasibility study and making this statement. So I know that you just met myself and Monica and Amy as the CCHICA team, but we also have about 6 other subcontractors that have subject matter experts in these different things. So we have a couple evaluators that are going to help us in terms of identifying the health indicators, of identifying, the questions we want to ask to really get to this disparity impact statement. We also have 2 different subcontractors that, their whole jam is policy, right? So they're going to help us look kind of broadly at, these may be the broad policies you want to look at. And then once that helps to get you some idea of like, oh, okay, that's how these different policies are impacting our water, they're impacting, our health and these environmental conditions, then that can, maybe surface some ideas from your counties, and then we can help you find those, more specific statutes or, policies that are maybe more local. So I just want to assure you that while you've met the 3 of us, there's actually even more support and more of a structure in place so that every step of the way, you have the support and we're helping you be like as successful as possible. Because I know when I first read all this, I thought, oh, wow, this is a lot to be working on if you don't necessarily kind of have that background. And so we definitely pulled in, and when I say we, especially Susan, pulled in a lot of great people to help us kind of throughout the way.
Diana, have your hand up?
Sorry, I'm really thinking this morning, which is a big old shock. So are you just able to subcontract with health councils, or can you contract with other nonprofits or groups that are specifically working in this area in a county? Or does it have to be the health council?
That's a great question. I know that I think our priority is health councils, but I don't know, at least I don't think there's a requirement for it to be only health councils. I don't know, Meg, if you feel like it's a different.
Susan, were you going to jump in?
I was. and the reason why I'm jumping in, I helped to design, worked with a lot of the partners in the project design. And we are targeting health councils, but it's not exclusive to health councils. We do want to see health council involvement because they are basically through statute, House Bill 137, responsible for health planning within their tribes and or communities, their counties. And so if it is another entity, we would like to see some type of relationship with the health council. And I will add, if we don't get enough health councils that apply, there is the possibility, and Meg will work with the project officer, but there is a possibility that we could open it up to entities other than just health councils.
But right now exactly. And then right now the scope of work has it for health councils. So like Susan said, if we needed to, we definitely could, but that would take a little, it would just take a little something to get that shift.
Yeah, and I think also what Susan said, it's not that it can't be, it would just be wanting to be in close relationship with the health council if it's not the health council itself doing it. That makes sense? Yeah, so that would be year 1. It's heavy, but like Meg said, you're gonna have a lot of support. There's a lot of different entities in play in this grant. So definitely if there's something that scares you on here, I wouldn't use that as a reason to not apply. I think there's definitely a lot of support to back you up. So then phase 2 would be implementing the DIS plan that you created and working on your proposed policy. And as Meg said, when it's time to decide if you're going to create or revise a policy, we're going to have a bank of policies that we have already assessed. The background team will have already assessed. So it's not going to be you having to single-handedly dive into your local legislation and decide what you think it could be changed or couldn't be changed. So it's going to be a lot of teamwork in that aspect. So year 2 will be focusing on how you're going to execute and implement your DIS action plan and collecting the data to monitor how the health effects and impacts of your plan are working in your community. And some key things that will need to happen are identifying your stakeholders, meeting with your local legislators and other elected officials, engaging with your community members, and engaging with organizations. So yes, Susan.
Yeah, in phase 2 with implementing, you've identified a policy at this point, or all the health councils have identified a common policy area. This particular grant is also very interested in mediating the structural racism impacts of what a policy may be. So maybe you don't want to necessarily change a policy, but during this implementing stage, you are measuring the impact and potential impacts of health disparities due to structural racism. And so based on that, maybe the policy is actually really doing a good job in addressing health disparities. And so, but you'll learn that through the second phase. Or if it's not, through the data that you're collecting, you may make recommendations for changing that policy.
Anything else to add on this one? Anyone? CHI? Nope, feeling pretty good. Okay.
I think you're good.
Then phase 3, which would be year 3, would then be, analyzing the information and everything that we collected in year 1 and 2. Really, like Susan said, if what you find is that it's actually doing a really great job, the policy that you're targeting, that would all be analyzed and written about and reported in phase 3. And also very important is to make sure that we distribute the results and everything to your communities and not just have this be an overarching like a big old report that's not easily read by communities. It's not very helpful, especially if we're trying to target racism and structural racism. We want to make sure that the results are easily consumed and reported to everyone's community properly. So what's expected of you, right? That's what you want to know. The grant funds the 6 selected health councils at $20,000 a year for the 3 years to carry out the goals and objectives that we talked about in each phase. We want to our goal is to really develop a schedule and framework that fits well with everyone's health councils and your community and your priorities. So we don't know exactly what that will look like yet. We're hoping that we can work with you in what exactly that can look like for the rest of the grant. But we are asking and estimating about 40 hours per month from your health council. There'll be an in-person or kickoff meeting sometime in early 2023. I think we'll probably end up averaging about 1 training per month, especially in the first year. It might taper off a little bit more in the following years, but it'll be pretty easy on the trainings and definitely very insightful information. And then we'll do very brief monthly check-ins with each health council. So the CHICA team and me will meet with health councils every month to make sure we're on track. They don't need anything. And like Meg said, as we talked about all the support we have, those monthly check-ins will be times that you feel like you're lacking in one area and you need a lot more assistance, that would be the time that we talk about how to bring in our other subcontractors on the grant to make sure you feel equipped in every stage. And then it will be quarterly reporting and invoicing. Anything to add, anyone?
And I think it's just important to know that in terms of like the trainings and the monthly check-ins, those are really going to be tailored to what you all need, right? So if, it seems that there's, one aspect of assessment or one aspect related to the disparities impact statement that people are a little hazy on or a little unclear, then that's really what we'll focus on. So it's not like it's like these cookie cutter trainings and cookie cutter meetings. They're really going to be focused on what you need to be successful and feel like you're able to get what you need from your community and provide what the community needs throughout the whole process.
Yeah, and especially if when we are doing the monthly check-ins and multiple health councils are struggling with the same thing, we'll most likely just have a training on it instead of, individual. It always works better. And I think it's also nice to know that other health councils are struggling with the same aspects of grants that you are. So trainings can help everybody come together to work together to get to the same end goal. So yeah, like we said, we're hoping to tailor it, all of it, mostly the schedule and the framework to the needs of the health councils once they are all selected and on board. So there are some counties and tribes that are most significantly impacted by droughts in the region. So those counties are San Juan, McKinley, Sandoval, Luna, Doñana, Otero, Cibola, Sierra, and the tribes are Cochiti, Navajo, Jaimes, San Felipe, Santo Domingo, Mescalero, and Laguna. And so we are asking these counties and tribes to highly consider applying because it is so impactful in your community, but this is not to say that all health councils should not apply for this grant. We are encouraging everyone to apply and we will consider everyone for this grant, but we just are considering these a little bit higher because of how highly impacted they are by drought.
And I do want to add, we're talking specifically of the health impacts, and these are based on CDC recognized climate change related health indicators. So if anybody has any questions, they can reach out to the CHICA team.
Okay, so there is an application form. I think it's been sent out a few times through our communications. Carrie can also put it in the chat. So it's just a Google form. It looks a lot like our monthly reports for the CDC Kellogg grant if you're on that. The deadline for the application is on the 23rd of December. There's only about 7 actual questions besides your name, email, and health council. Some examples of what the questions look like if you haven't looked at the application yet are: why are you interested in this project, and how does this project build on your existing work and connect to your current priorities, especially with the CHIP in mind. If you can think of ways that these can coincide with your CHIP priorities, I think that's also something we can talk about and work through in this grant as well. So if you have any questions about the form, Carrie just put it in the chat, but you can feel free to email me. I'm happy to answer anything. I'm happy to walk through the form with you, anything like that. Most of the questions are paragraph format, but there are just a few that are multiple choice and or rankings. So yeah, I think, yeah, I can absolutely send it as a Word doc. That way you can also submit it that way. It doesn't have to be submitted through the Google form if it's easier for you. So yes, go ahead. I don't have a name, but whoever has their hand raised. Oh, Anna, hi.
Thanks. Yeah, good morning, everybody. Thanks for putting this together. It's really helpful. I'm signing in just to learn more for the Bernalillo County Health Equity Council. And I have a couple questions. I'm wondering if you guys, somebody on your team, could just kind of walk us through like what an example might look like if you are a health council doing this project. I know, policy analysis within your jurisdiction or something, just kind of what if we're on the ground. I see somebody say the internet's lagging, so I hope you guys can hear me because sometimes mine comes in and out. Okay. Just kind of like, okay, you would like go online and pull up your city's bills and look for, word search for climate or drought, and then read them all and then decide which one is most exciting. I mean, like, or would you also do that at the county level? If you're a tribe, are you doing that with your tribal policies, or are you doing that with your county or city? Are we looking at state policies? How are we finding these? How many bills are out there? Do you guys know, like at the city level? Are there 5 bills? Are there 50 bills? Am I going to be looking at all of them? And maybe bills isn't the right word. Maybe it's policies. So just kind of walking through that and like an on the ground, what is this going to look like? And then maybe a second question, and maybe for somebody else, is around connecting this to, racism, structural racism. I mean, it's like, yes, there is a lot of research out there showing like environmental justice is racial justice. And I think on a theoretical level, that makes a lot of sense. But if you guys could also talk about what does that look like on the ground in terms of making those connections. And I know, maybe we haven't done this yet, so we don't know what it's going to look like on the ground, but I just think that would be really, really helpful for me and hopefully for other people thinking about applying.
Do you want me to jump in, Rebecca?
Yeah, I was gonna say, I saw you on mute, so please go ahead.
Okay, great. Yeah, okay, so so the first thing that while you all are, deciding if you want to join the project and talking to the communities, we in the background are already starting to research the policies. So, and the statutes, really. So we have 2 different subcontractors whose focus is policy, and one is specifically environmental policy in New Mexico. So what we'll be doing is looking at some broader state statutes that may be useful, or maybe something you all want to target. And then once we know which health councils and tribal councils are selected, that will then allow us to be a little bit more specific in the statutes that we look at. So then once the councils are selected and we see kind of where you are in the state, what we're also looking at are the different like health indicators, right? So if you're in a county where we know that, for instance, like there's really high respiratory issues because of when the wind season comes, like everyone's having respiratory issues, things like that, there's then we can focus on, and you want to focus on that type of like health indicator, then that's what we'll look at more. So it's kind of like a multi-step process where we're going to be doing work in the background to help you kind of have an idea of where you want to go. And then once you hone in on what's most important to your counties, then we'll get more specific into, oh, here's the different statutes we found that we think might be helpful. We'll also have a training to help you identify in more of the local level where you can kind of find that data and find all that information. So it's kind of going to be happening kind of simultaneously as you all are kind of going through the application process. And I felt like there was a second question in there as well.
How this is gonna actually impact structural racism. I think that's a great question.
Okay.
Yeah.
Yeah. So and Susan did a whole lot of research on that. So I don't know if she wants to jump in too, but in terms of the project proposal, Susan also worked with the New Mexico Community Data Collaborative to kind of like look at the different populations throughout New Mexico, and depending on kind of what the environmental factors are in those different areas, you know, and what the populations are there, that is how they're impacting them kind of the most, if that makes sense. I don't know, Susan, if you want to jump in.
Yeah, so the 6 health councils will come to consensus around a similar policy that they all are going to research. So it could be something around access to water, or maybe it's how to mitigate particulate matter, but it'll be something in common, which through the help of CHI, they'll help identify those specific policies for you. So, and then the health councils will be able to say, okay, let's come to agreement around this particular policy. And then health councils will do more of the work around the health impacts that those policies may influence. And then the structural racism comes in. So as you look at the indicators, the health indicators within your jurisdiction related to that policy, who is being, you'll be answering questions like, who is being impacted? Is there differentials? Like, do some people have more access to cleaner water than others, or are some populations more subjected to high particulate matter than others, and why? So those are the types of questions that the health councils will attempt to answer, looking at more population health to determine are some of those impacts due to racial structural racism, and if so, what can we do to correct that? I hope that answers the question.
And one more thing, I just want to jump in. We also have subcontracted an evaluator. And so as Susan said, you know, there's going to be different questions that the health councils will be asking to see how their communities are impacted. The evaluators will be helping you kind of form those questions if you want assistance with that. So they're also there to help you so that whatever questions you're forming really leads you to the answer that you're looking for.
And I hope that answers your question. I know it wasn't I hope that answers your question of how it will look for you, right? It's not you just having to go search the internet of policies in your area and try to, you know, grasp this really big concept with just your health council.
And as you get into the implementation phase, so if you make a recommendation that, gosh, if we made this particular intervention more accessible to certain populations, then you'll be able to study that and say, does that make a difference? And this is where the community action comes in. So as you get into that implementation phase, you'll be working really closely with communities. So maybe you may reach out to community to help you prioritize what policy area to focus on that you think would be beneficial. And then of course, come to consensus with all the health councils. And then during the implementation phase, you may also want to engage your community in terms of who is being impacted and what interventions might make that policy better. And then of course, they'll be, you know, collecting some data and then analyzing the results and sharing that with the community as well. So there are in each phase, you know, opportunities to engage community as well.
Any other questions?
Rebecca, before questions, I just want to throw this out there. We know that currently health councils, many of you are participating in the community health improvement process and community health assessments and community health improvement planning. Many of you will be identifying your health priorities, hopefully by the end of December, and then beginning to develop your plans. this project, the CHICA project, can go hand in hand with your CHA and CHIP process. So if your health council has recognized climate change as one of your priorities, this would just allow additional resources to help with the planning of your with helping with actually doing something about that priority. Just the same way, like if you had substance abuse as a priority and you know there are other resources to help address substance abuse in your community, this offers additional resources to help address climate change if your community is identifying climate change. So the two do go hand in hand, your community health improvement plans as well as the CHICA project.
Okay. Anything else? And I just shared the slides in the chat. I can also create a Word doc /PDF of the form so you can work on it outside of the Google form format. And I can send that out later today. Any other questions, comments, concerns? Oh, Anna?
I do have another question, and I just wanted to show my hand raised so that we don't end the meeting, but I also want to just give time for somebody else to ask a question if they have questions.
I will also put both mine and Monica's contact information in the chat. So if you think of any questions afterwards, can't think of any right this minute, I am more than happy to answer any questions. I'm more than happy to get on a phone call, try to talk about how this is a good fit for your health council, to go over any of the questions on the application. Happy to be here and assist you. Yes.
Hi, I guess, hi, everybody. What type of activities are you foreseeing that the budget would be used for? So you said 20,000 a year per year for 3 years, so a total of 60,000. When I divide that out, it's about 1666 a month. Are you foreseeing that mainly all as like coordination, like perhaps a person that would coordinate this effort for the health council? Or are you seeing, like, would some of that be convening public meetings on this topic or doing some engagement type stuff? I'm trying to just envision. So it sounds like we have technical support regarding the water conservation, and if we engage like our soil and water conservation district and our city and our county officials, like, what do you foresee the spending should be used on, and how's that drawn down?
That's a great question again. I can't say I can answer that. I don't know if Meg or Susan, if there was something more concrete that was a thought.
Yeah, and Susan, feel free to jump in. But I see it, in the coordination. So, coming to the, the different meetings, meeting with your community, the time it takes to, look at the different health indicators, to identify, the policies, to work with your communities in terms of the, the health indicators. So yeah, I see it really kind of like, I don't know what the right word is, but like just like the work part of it, right? So that the person who's really, working with the communities and meeting with us in terms of the CHICA group and Rebecca. And then there's obviously the report, so that's going to take a little bit of time. So that's kind of how I see it. The deliverables are quarterly, so then the invoicing would be quarterly. So you'd have a subcontract with CHI, and then kind of the way it'll kind of be funneled through Rebecca. So basically, as you get towards the quarterly invoicing period. You'll be working with her to make sure that you have all the deliverables in line, and then she'll say, yeah, they're right on track. You'll invoice us, and then we'll fulfill the invoice.
So sorry, just to follow up. So it'd be quarterly, it'd be $5,000 drawdown at a time. And it's just kind of, it's not like, oh, we're billing our hours for this quarter. It's just like, yes, they're on track. Here's this $5,000 for this quarter. Is that how you envision it? Okay.
Yeah, like more like deliverable based kind of thing. Yeah.
Yeah, and it's really, like Meg said, it's primarily probably time and effort, because we need someone on the ground to attend the meetings and do the follow through and meet with community. Could be more than one person, but we're leaving it up to the health councils on how they want to spend that 20,000, as long as it is allowable within the grant. And many of you are familiar with federal grants. So obviously, staffing is allowable expense, but you couldn't necessarily take the money and go off to Hawaii or something. So as long as it's allowable within the federal grant.
Well, shoot, Susan, I guess we're not applying then. Okay, thank you guys. I'm going to go back to the question I asked earlier and just ask it again as I'm looking at in detail. Thank you, Rebecca, for sharing the slides. So I'm on the examples page. And so I guess if we picked something like, air quality monitoring, I'm just wondering if somebody could walk me through, even this feasibility study. So if air quality monitoring is what's been chosen, then we're going to develop questions and conduct an assessment and complete a feasibility study. So what does that look like if we have an example? And then we're going to develop this disparity impact statement with an action plan for how the Health Council is going to address air quality. And then we're going to take that plan and then we're going to start collecting data. So we're going to be collecting data on what the amount of how bad the air quality is, or what the health impacts are, and how are we going to do, how are we going to collect that data? Or are we just getting data that already exists out there? Or are we doing primary data collection associated? And then we're going to do these key actions in phase 2. So then we're going to meet with our local legislators and elected officials and engage our community and engage organizations around what we're letting them know this policy exists and what the impacts are, and that we're collecting this data, and then we're asking them to. So am I way off, or is this I'm just trying to get a sense of, so many of us sign up for these grants and then we get started and we're like, what? WTF, excuse the French, but so I'm just really wanting a sense of, as far as you guys know, detailed, what does this, I don't know exactly what you mean by a feasibility study, or how much, or what you mean by data collection. And then also going out, meeting legislators. And I just look at phase 2 and that looks like a full-time gig for, a specific so I'm just trying to get a sense, and I apologize for re-asking the question, and I hope I'm not wasting people's time and that this is helpful.
Rebecca, you want me to jump in? Yeah, so the one thing I realized we didn't mention, which I feel like is going to answer your entire question, is that there's going to be a training on what's called a legal epidemiology framework. And that's basically an entire framework. And the training is going to be from, it's with the CDC, and I can't remember the other organization, I apologize. But they're contracted through the Office of Minority Health. So they're, our grantors are providing this training. And it basically walks us through that whole step. It helps us identify, once how do you look at policies? How do you identify policies? How do you then look at their impact on the community? how do you get that data? Because you're going to get it from different places. And we also have MOUs with different organizations that already have this data to help us grab it. And then we'll be doing the data to action training, which also helps us identify how to get the data. But this legal epidemiology framework is really, I think, what you're asking, like, what is the process, right? And it's really the entire framework of how we go through this, because what we really want to do is really use like a scientific method to look at policy, right? And so it's a very structured framework and format in order to do that. So I'm hoping to learn, I have a meeting where we have a meeting, my team and I have a meeting Wednesday with our project officer with the Office of Minority Health. And I'm hoping that at that point, they'll tell us the dates of that training. It's going to be virtual. And so once we have that training and know that framework, that's really going to help inform us in the best step-by-step way to move through this process. Does that help?
Yeah, kind of.
And I think some of the reasons why our answers are a little vague is that until we know which councils, until we know the topic of the policy, until we know the health indicators, it's kind of hard to kind of drive down some of these answers.
And one example you mentioned, Anna, as a potential, just to kind of give an example, is monitoring. Suppose it was air quality monitoring. There are state statutes around air quality monitoring, and there may also be local jurisdiction statutes on air quality monitoring. But what if we find out that the state only has 20 monitors in the whole state that they're collecting data? And so in your community, the health council is working with their county or tribe to get additional monitoring, especially in locations where we know there's a high potential of particulate matter that is causing air health impacts. So that might be, once, like Meg said, once there's consensus in terms of what is the policy area where we could impact and actually begin to assess what kind of impacts that policy is having on populations in our communities. Really, that's what we're looking at, but that would be like a concrete example of how this could apply.
Any other questions?
I have a question. I'm just wondering from our health council's point of view, from just the coordinator point of view, just to say, I am a full virtual, I should say I'm part-time, but fully virtual coordinator. How does that work into this? Well, I know you said one of the meetings, I know the first one or something like that, maybe in person, and you know, you need someone on the ground. So just that type of language, I'm just trying to wrap my head around, will this still be a good fit? Or would we need, as far as a coordinator taking on portions of the project, or will we need to onboard someone for this project and specifically?
Ursula, it really depends on every health council. In some cases, The health council, the coordinator is completely, they have no capacity to take on an additional project. And with other health councils, the coordinator may actually have a capacity to add the extra 10 hours a week. So it really depends on each health council and what their current staffing looks like. But if you want to reach out to Rebecca and talk a little bit about your unique situation, I know she'd be happy to talk to you.
Yeah, and I also would not say that the in-person meeting is required that you are there in person. We all live in a virtual world these days, so that's definitely not a requirement for you to show up in person. So
Okay, I was just, yeah, kind of wanting to know how the hours, how y'all want that to go, if onboarding is a option or anything like that. Okay, thank you so much. I appreciate it. And thanks, Rebecca. I was reaching out.
mhm. Yeah, and I'm happy to talk about it. Happy to go over what it would look like for you. And like we said, we're trying to make this, we want to do this with you in mind. We don't want to give you this set of things that you have to do. We want to make sure, and that's why we're trying to involve you early, is making sure that you are a part in how the trainings happen, when the trainings happen, have a say in how this all works.
And I think it's really going to be dependent on, the councils and the communities. If all the councils, are working virtually and all the, meetings are virtual, then there's no reason for us to say, oh, you have to be in person. So it's really whatever works best for your community. And if right now you're working virtual, then that's working well for you. So there's no reason for us to, force you to change it for some reason. The in-person meeting, we were actually just talking about that before this. It was written in there to be an in-person meeting, which are always great. And, we're going to see, which councils are eventually on the project. Where are they? How easy is it for them to travel? And then, we'll reassess from there. So really just, trying to do the best we can so that everyone's most successful, and not making things unnecessarily difficult.
I know it looks like a few people jumped on after I put everything in the chat. So I'm going to go ahead and put the slides in the chat again, as well as my contact information. You can also access all of this on our website, and I will send out this recording, the slides, contact information, all of the above out after this meeting, so you'll have it. We do have another meeting, another info session, pretty much the same thing on December 6th. We wanted to be able to have health councils. I know a few couldn't make it today, so we wanted to have 2 sessions. You are welcome to come to that. It will look pretty similar to this, but if you want to talk in person Zoom about your questions that maybe you think of between now and the 6th, please come back. If you think of anything in between, reach out to me. I'm always happy to talk. I don't know if anyone has anything else to add or any questions.
Sorry, what time did you say on December 6th?
It is 3 o'clock to 4 o'clock. I will send out another invite like I did for this one for the Google Calendar. It's also on our website, so you can add it to your calendar if you have Outlook or a different calendar software. Don't want to keep anyone. So if no one else thinks they have any questions or anything else to add.
Hi, Rebecca. Sorry, this is Iris. But I have a question. I know this is more regards to like the climate and the health grant, but I'm speaking for my pueblo, but it may also be for other pueblos too. We have an overcrowding or overpopulation of dogs. Would we be able to use this funding for that?
What is the,
Of like or like strays and just it's just overpopulated with like dogs and cats in our, well, and I know for my pueblo, and we have we started working on a kennel with some of the grants that I had under the 638 program, and we're going in phases, and right now we're at a halt. And we started this kennel for dogs, but I'm trying to look for other funding, but I don't know if this will be an appropriate question to ask.
well, this is really focused on environmental health policy. So it would need to somehow be related to environmental health impacts, right?
Okay, I just
so-
thought I'd ask.
And it might, I'm not really, it might, I mean, I'm not sure what, I mean, I'm sure there's some type of health impacts to having an excess of unowned dogs, right? But what those are exactly, like, I'm not sure. So it would just need to, you would need to find a way to connect it. And then also for it to be related to kind of like, the broader, topic related to environmental health.
Thank you for that. I appreciate it. I just thought I'd ask.
Of course.
Hi, this is Geraldine. I was gonna say definitely I definitely feel like it could definitely connect to some of the environmental and climate stuff impacting health in reservations. And I think this is just a new topic, not new to tribal communities, definitely maybe something that hasn't been a priority for the state. So when we think about tribes and some of the health priorities, dog overpopulation is probably pretty much seen in a lot of the tribes across the state. So I think there's definitely a way if we can support the Pueblo of Santo Domingo and linking some of this and finding some data. I think that would be, really helpful.
For sure. Thank you, Geraldine.
And also keep in mind that the 6 health councils chosen have to come to consensus on a drought-related policy that is going to, that impacts all their communities. So that's something else to keep in mind. And so yours may be a little bit unique, based on the example you gave. So just something to think about.
Yes.
Hi, I just want to clarify, I think, and I'm sorry if this is repetitive, but the main deliverable, the overall expectation is the DIS and then recommendations to your local bodies that can implement those. But it's not necessarily like, let's say that a health council conducts all of that and submits a DIS and comes together with the other 6, with the 6 awardees, and they come to some, universal recommendations for their communities or New Mexico in general. But there's not this expectation that our county or our city will actually implement that. That's not, that's not always something that we can impact, right? So unfortunately, we wish we could. It sounds like it's policy recommendations and an impact statement, but those are the deliverables that a health council would be expected to meet, not implementation. Do I have that correct?
I don't know if Meg, Susan. Calling you again.
Sorry, could you just say that one more time?
Okay, no problem. And I'll try to be more concise. The deliverables, the final deliverable or the deliverable expected from the Health Council is the DIS and then recommendations. But implementation of all policy recommendations, like if those would be up to a local governing body, we don't necessarily get to make sure that happens? Where does the expectation stop? Like, where has the Health Council met its deliverable? And yeah.
Yeah, and correct me if I'm wrong, Susan, but I want to say, you have the DIS statement. We do the analysis using the legal epidemiology framework. We provide our results and our recommendations, and then we disseminate them. And that's the end. The hope is that there's change, or, if we find something that's really effective, then it's, maybe then replicated other places. But does that sound right, Susan?
It does, but however, during the implementation and the analysis phase, we're really hoping that the health councils are engaging with key decision makers so that those recommendations have more likelihood of being palatable, and hopefully people will, especially key decision makers or policymakers, so that they're engaged in the process of formulating those recommendations, so that maybe they do have a pretty good chance of being enacted upon. But you're right, Maureen, the actual deliverable is just to make the recommendations. You're not expected to make sure that new policies or different policies are passed.
Be great if you could, right? Wouldn't we all love to?
I think that's a great point, though, Susan. If you're engaging those legislators as you're forming the recommendations, then they're definitely going to be in a format that's going to be more likely to be enacted.
Yeah, and the decision makers, because certain jurisdictions also have local policymakers, and so it may not necessarily be a legislator. It could also be, maybe someone from the water district, or a city councilor, or county commissioner at all, or a tribal leader, of course. So those a variety of policymakers.
And I did just want to mention, I know I mentioned that there's the data training. So we have a data training that's going to be provided by the New Mexico Community Data Collaborative, which is also another department with CHI. But then I'm also going to be contracting with another entity that focuses on tribal data. So then they'll have a training that's very specific. So data sovereignty is very much respected, and so we're also taking that into account. And one of our partners is the Center for Native American Health up at UNM. So we also have kind of like another branch of support that's very specific to the tribes and the Pueblos. So we make sure that they get exactly what they need in the most appropriate way.
Yeah, thanks for mentioning that, Meg. Okay. Anything else? Like I said, I'll put my contact in the chat one more time. But if you think of anything, like I said a million times already, reach out. I will put the application in the chat one more time, and then I will also make sure to send it out in a editable, easy to manage format to all health councils as well. Okay, well, thank you all for coming. Hope you have a great, wonderful rest of your day. Monday back from a holiday break. Hope it goes by quick. Bye, everyone.